Coffee Break Collection 17, Health and Fitness. This is a LibriVox recording. All LibriVox recordings are in the public domain. For more information or to volunteer, please visit LibriVox.org. Mayo'S Anaesthetic by Joseph R. Buchanan. The suspension of pain under dangerous surgical operations is the greatest triumph of therapeutic science in the present century. It came first by mesmeric hypnotism, which was applicable only to a few, and was restricted by the jealous hostility of the old medical profession. Then came the nitrous oxide, introduced by Dr. Wells, of Hartford, and promptly discountenanced by the enlightened medical profession of Boston, and set aside for the next candidate, ether, discovered in the United States also, but far inferior to the nitrous oxide as a safe and pleasant agent. This was largely superseded by chloroform, discovered much earlier by Liebig and others, but introduced as an anaesthetic in 1847 by Professor Simpson. This proved to be the most powerful and dangerous of all. Thus the whole policy of the medical profession was to discharge the safe and encourage the more dangerous agents. The magnetic sleep, the most perfect of all anaesthetic agents, was expelled from the realm of college authority. Ether was substituted for nitrous oxide, and chloroform preferred to ether, until frequent deaths gave warning. Nitrous oxide, much the safest of the three, has not been the favourite, but has held its ground, especially with dentists. But even nitrous oxide is not perfect. It is not equal to the magnetic sleep, when the latter is practicable, but fortunately it is applicable to all. To perfect the nitrous oxide, making it universally safe and pleasant, Dr. U. K. Mayo, of Boston, has combined it with certain harmless vegetable nervines, which appear to control the fatal tendency which belongs to all anaesthetics when carried too far. The success of Dr. Mayo in perfecting our best anaesthetic is amply attested by those who have used it. Dr. Thorndike, than whom Boston had no better surgeon, pronounced it the safest the world has yet seen. It has been administered to children and to patients in extreme debility. Doctors Frizzell and Williams say they have given it repeatedly in heart disease, severe lung diseases, Bright's disease, etc., where the patients were so feeble as to require assistance in walking, many of them under medical treatment, and the results have been all that we could ask: no irritation, suffocation, nor depression. We heartily commend it to all as the anaesthetic of the age. Dr. Morrill, of Boston, administered Mayo's anaesthetic to his wife, with delightful results when her lungs were so badly disorganized that the administration of ether or gas would be entirely unsafe. The reputation of this anaesthetic is now well established. In fact, it is not only safe and harmless, but has great medical virtue for daily use in many diseases, and is coming into use for such purposes. In a paper before the Georgia State Dental Society, Dr. E. Parsons testified strongly to its superiority. The nitrous oxide, says Dr. P., causes the patient, when fully under its influence, to have very like the appearance of a corpse, but under this new anaesthetic the patient appears like one in a natural sleep. The language of the press generally has been highly commendatory, and if Dr. Mayo had occupied so conspicuous a rank as Professor Simpson of Edinburgh, his new anaesthetic would have been adopted at once in every college of America and Europe. Mayo's Vegetable Anaesthetic. A perfectly safe and pleasant substitute for chloroform, ether, nitrous oxide gas, and all other anaesthetics. Discovered by Dr. U. K. Mayo, April 1883, and since administered by him and others in over 300,000 cases successfully. The youngest child, the most sensitive lady, and those having heart disease and lung complaint inhale this vapor with impunity. It stimulates the circulation of the blood and builds up the tissues. Endorsed by the highest authority in the professions, recommended in midwifery and all cases of nervous prostration, physicians, surgeons, dentists, and private families supplied with this vapor, liquefied, in cylinders of various capacities. It should be administered the same as nitrous oxide, but it does not produce headache and nausea, as that sometimes does. For further information, pamphlets, testimonials, etc., apply to Dr. U. K. Mayo, Dentist, 378 Tremont Street, Boston, Massachusetts. End of Mayo's Anaesthetic.